Hello friends, welcome back, Ghumare sir, your biology teacher, and we'll continue with the discussion on circulation that we started with. Last lecture we discussed conducting system. We say conducting system made up of four units: SA node, AV node, bundle of peace, and Purkinje fiber. How the contraction relaxation of heart takes place. We discuss contraction of auricle, contraction of ventricle, and relaxation of both will complete one step we call it a cardiac cycle. Today's lecture will discuss the next topic and that is related with blood vessel and blood pressure. We'll start with the blood vessels to discuss with. In blood vessel, we have three types of blood vessel. These are the branch tubule that extend from heart to the different parts of the body. These are called a blood vessel. We said we have three types of blood vessel. Number one is artery, number two is vein, number three is capillary. A study of these blood vessels, their histology, their details, this is a branch of zoology or angiology. A repeat study of blood vessels is called angiology, and three main types of blood vessel are there. This is the section of artery, as I already told you. This year we are going to concentrate on histology, taking section, observing under microscope. This is the histological structure of artery, this is histological structure of a vein, and then we'll have a capillary here, simple one. One by one we are going to study. Number one is the artery, the blood vessel which will carry blood away from the heart or heart to the various parts of body or organs of the body, and these blood vessels are called artery. So we have a changing definition of artery. This is the most appropriate one. Blood vessel that carry blood from heart to the different parts of body. This is called artery. Artery will divide, redivide. That will form a smaller artery. Remember, close to the heart we have a artery that is called aorta. That will divide, redivide to form artery. When it comes to the near organ, that will form arteriole. Smaller arteries are called arteriole. And near the organ, we'll have a thinnest blood vessel that is called capillary. Remember, these arteries are deeply located as the pressure is there in the artery. Blood pressure is there in the artery. They are deeply located, they are well protected. Only few arteries which are little superficial. Number one is present in the wrist region called radial artery. Number two, somewhere present here in this region called brachial artery. Similarly, in the leg region, that is femoral artery. They are little superficial, remember. Points which are not given in the book, but remember this is pinkish in color because hemoglobin will be associated with the oxygen, so that will form oxyhemoglobin complex that will develop pinkish color. Blood flow is always rapid and blood is under pressure here. This is to have efficiency of circulation. Histological point we'll repeat again. This is with thick wall and what a inner cavity is there that is called lumen, that will be narrow lumen. Generally, arteries carry oxygenated blood. Remember, arteries, we used to have definition blood vessel which carry oxygenated blood. And this oxygen containing blood that they carry, except the artery which is the one which carry deoxygenated blood is the pulmonary artery, the one which will carry blood from heart to up to the lung. This is pulmonary artery. So anything related with lung is pulmonary. Close to the lung, the artery is called pulmonary artery, which will carry deoxygenated blood. Remember, character of vein, actually walls are present in vein. Walls are absent here. Walls similar like heart we discussed. The walls which are for avoiding backflow of the blood. In case of artery, blood is pumped from the heart, so we don't have scope of a backflow. If at all backflow of the blood takes place, that is not problem. Oxygenated blood will be given back, and so walls are absent here. And we're going to study in pulse. One contraction of ventricle will create one jerk in the artery that is called pulse. And this nature of artery is called pulsatile nature. So remember, arteries are pulsatile in nature. This is something about the general characters of artery. Histology, I told you we want to concentrate. Taking section, observing under microscope. Same section I'm showing here. We have this is the wall of artery, and the one which is made up of three layers. Outer one is called a tunica externa, the one which is also called tunica adventitia, the one which is outermost, the one which is thick, the one which is tough, and the one which is made up of collagen fiber. Areolar connective tissue, we studied two types of fiber which are Collagen fiber made up of protein collagen. They are for white fiber also. They give toughness. They are for protection purpose from outside. Second layer is called tunica media. Middle one so called media. The one which is thick in case of artery. The one which is made up of two things: smooth muscle and elastic fiber. Elastic fiber will give elasticity. The one which are called yellow fiber, and they are arranged in a circular manner, like this circular manner, and they are the one which make this middle layer thick. This is to have sustain the pressure during the flow of blood. Artery wall is pulsatile because of this particular layer. Then innermost one is called tunica interna intima, and the one which is made up of single layer of flat epithelial cell. These cells are called endothelial cell. And remember, they are the one which surround this particular human, and the one which is internally lined by a membrane, elastic membrane. This is called an elastin. This red color one is the elastin, remember. So we'll have a three layers here. The outer one tunica externa, middle one tunica media, and inner one tunica interna. Lumen here is without any wall. I told you this is a small lumen as compared to the when we are going to compare. Next, regarding the second blood vessel, these are called veins, blood vessel, which will collect the deoxygenated blood from all parts of body, even heart, remember. And the one which will return back to the heart, this is called as veins. The one which are superficial. See here, these are the veins generally. The one which are red or purple in color because oxygen is not there. Hemoglobin will be free and that will impart red color to the veins. They are the one which are thin walled and with a large lumen will study in histology. They carry deoxygenated blood, oxygen devoid of blood, and the one which is with one exception, pulmonary vein. So I told you the artery and vein related to the lungs, they are the exception, remember. The one which will start from heart, the one which will be carrying oxygenated blood, the one which will start from lung and supply the blood to the heart. These are called pulmonary veins. They are the one which will carry oxygenated blood. Otherwise, all the veins in the body, they'll carry deoxygenated blood. Blood is flow is very slow here. The pressure will be negligible. That is called venous pressure, and the one which will be negligible here. Larger veins are provided with a flap. I told you these are called walls, and this is to avoid backflow of the blood. Why? Because I told you if the blood go back to the organ, this is deoxygenated blood that might harm the organ. So to avoid backflow of the blood, veins, specifically larger veins, are provided with flaps called valves. And as we don't have any pumping organ to push the blood in the veins, these are non-pulsatile in nature. This is to differentiate from artery, which are pulsatile in nature. Histological point will concentrate here. Wall of a vein made up of a three layers similar to the artery, tunica externa, media, and interna. Externa will be similar here, that is made up of collagen fiber. This is for protection, toughness that they will give. Media will be made up of again smooth muscle and elastic fiber, but this time it will be thin one as compared to the artery. And tunica interna will be again similar, made up of a single layer of those endothelial cell. And because of this thickness, minimum thickness of media, total thickness of a vein will be minimum. And that way the lumen will be larger as compared to the artery, lumen will be larger. Internally, I told you here I'm not showing that is present in large veins. Actually, we have such a type of flaps, and this regular interval we are having those internal walls. This is to avoid backflow of the blood. That's it. This is something about vein. Next one, the blood third and last blood vessel is for capillary network of minute blood vessels. Remember, when artery will start from heart, that will divide redivide to arteriole. Finally it will come to the single cell layer thick artery, and this will be called a capillary. The wall is extremely thin and stretchable, remember, because it is single layer thick. Tunica externa media is completely absent here. So here cellular diagram is not shown, but remember external layers, two layers, they are completely absent here, only represented by tunica interna with that squamous epithelial cells resting on the basement membrane. If this is a basement membrane, these are the kind of a cell that we have. And this capillary will be close to the organ for exchange of a material. Remember, wall of a capillary is with those small, minute pore, endothelial pores, we also call fenestrae, and through which the blood cells, specifically WBC, will come out to give the nourishment to the deeper part of the body, and they will escape. WBC will escape because of those pseudopodia we already said, and the process is called a diapedasis. I'll repeat: tunica externa, tunica media completely absent, interna represented by single layer of squamous epithelial cell, and those openings will allow WBC to escape by the process called diapedasis. That's it. This is something about three types of blood vessels. The important point we'll study related with this is the pulse, the series of pressure wave that is present in the artery. This is called as a pulse. I told you one contraction of a ventricle will create one jerk in the artery, and that will develop one pulse. Remember, definitely it will be strongest or closer to the heart. It will be strongest. Gradually, it become weak somewhere here, and here we feel the artery. In finger, we never. So we'll have certain point in the body. Two artery that we generally doctor check. Number one, the artery which is present here. This is called a radial artery in the wrist region. And one artery present here, this carotid artery present in the neck region, where we can feel the pulse. Remember, we have those particular points present in the body. See, two I have shown here. The radial artery is present in the wrist region, and the another one is called a carotid artery in the neck region. Few more points are there that you can study. These are called as pulse location points in the body. Remember, one heart ventricle contraction develop one cycle in the heart, and that way one jerk in the artery, that is called pulse. So remember, pulse rate is equal to the heart rate. How much it is in a normal healthy person? It will be 72 times per minute. So we feel those 72 jerk we call pulse in the artery. Anything less, anything more problem. Tachycardia is the situation where higher pulse rate is there. So 100 beats per minute. This is called tachycardia. So when we run, we feel the pulse. Remember, but that come down to the 72 again. But if a person with abnormality in the body, and if taking the rest, if the pulse is 100 and more per minute, this is called a tachycardia. Slower pulse rate 60 below per minute, 60 beats per minute and less, this is called a bradycardia. Both are problem, remember. Next, we'll study about blood pressure. The pressure exerted by this blood on the walls of blood vessels is actually called as blood pressure. So remember, it is not directly artery, it is the blood pressure. Either it could be the artery, it could be the vein, or it could be the capillary. So pressure exerted by blood on the blood vessel, this is called as blood pressure. We already say we'll have negligible pressure in capillary. We'll have negligible pressure in veins, that is for venous pressure. So main and important is the arterial blood pressure, the pressure exerted by flowing blood on the inner walls of an artery, and this is called arterial blood pressure. The pressure is measured in this particular artery because definitely like pulse, pressure will be more near the heart. Pressure will be negligible here. We measure it in the middle. This is artery present here in upper arm is called brachial artery, and we measure with the instrument called sphygmomanometer. Sphygmos means pulse. We are going to study two types of blood pressure we have. One is called systolic, one is called diastolic. Systole means contraction, diastole means relaxation. So pressure on arterial wall during ventricular contraction. Now think of, the pressure will be little maximum, and the pressure on arterial wall due to the ventricular contraction will be little maximum. This is called systolic BP or systolic pressure SP. In a normal healthy person taking the rest, systolic BP will be 120 mmHg we measure in a mercury column. Okay. Second one is the diastolic pressure, where pressure on arterial wall during ventricular relaxation. So think again, when ventricular relaxation is there, pressure will fall a little bit. And this is called a diastolic blood pressure, the one which will be 80 mmHg in a healthy person taking the rest. So we can't express BP in terms of only systolic or diastolic. It should be ratio of systolic to the diastolic, 120 by 80 mmHg. This is the normal blood pressure of a person taking rest, a normal person. And then a medical term that people use is pulse pressure. Difference between systolic and diastolic blood pressure is called systolic blood pressure. How much it will come for a normal person? It will be 40 mmHg. We'll have importance of blood pressure because any deviation in the normal blood pressure value 120 by 80 mmHg that indicate a malfunctioning of heart. And malfunctioning may be due to many reasons. Number one, high or low blood volume. If an obese person is there, more blood volume will be there. That will deviate the blood pressure. We'll study types afterwards. The arterial inelasticity or what you call hardening of artery. See two possibilities I'm going to tell you. Number one, if deposition takes place in this artery wall, that will decrease the elasticity of artery. This problem is called arteriosclerosis. And deposition of a fat like cholesterol takes place from inside the artery, like this, from inside the artery in the tunica interna. And this is called atherosclerosis. So remember these two words from multiple choice point of view. Arteriosclerosis, deposition of material in the wall of artery, and the deposition of material from inside the lumen. This is called atherosclerosis. Both will deviate the blood pressure. Then we'll have renal diseases, kidney diseases will deviate. Number two, emotional and induced hormonal changes. Maybe if at all we are too happy or if at all we are too sad, that will deviate the blood pressure. Obesity is the main reason for affecting the blood pressure because more blood vessels will be formed. More will be the fat deposited in the body. More will be the volume of blood, and that will deviate the blood pressure. So we'll have two types. One is called as hypotension or low blood pressure. This is blood pressure lower than the normal. 120 80 mmHg is a normal, 90 and 60, 90 by 60 mmHg and low. This is called a hypotension. We call it as low blood pressure. And you must have heard about hypertension or high blood pressure, where blood pressure is normal, more than normal, 140, 90, and above, consistently, not for one time, consistently. And this is for hypertension, we call a high BP. Think of which one will be more problematic. Low BP is more problematic, or high BP that you make you own. Okay. And then which all factors that they affect the blood pressure? Number one is the cardiac output. Normal 5 liter per minute is the cardiac output we said. And if it increases due to obesity, increases due to one other reason, and increase in the cardiac output will increase the systolic BP specifically, not diastolic. So cardiac output directly proportional to increasing the BP. Second is the peripheral resistance. Increase in the peripheral resistance will increase the blood pressure. Peripheral resistance means we have a chemical called vasoconstrictor. Vasoconstrictor will constrict the blood vessels. Less amount of area will be available for creating pressure, and that increase in the peripheral resistance will increase the blood pressure. Next one is the blood volume, and we discuss again and again regarding increase in blood volume. Your decrease in blood volume due to the accident, loss of blood due to the accident, that might decrease the blood pressure. So you must have seen many people suffer with problem when it is accident, loss of blood is there, that will deviate blood pressure. Age is the important factor again. BP will increase as per age because as per age the body in elasticity will be there in the blood vessel. Deposition of material will take place in artery wall, and that way blood vessel become inelastic. This happens in old age people, and BP will increase as per the age. So we say 40 or 50 age above, we should take care. Venous return is another factor where amount of blood brought to the heart via veins. This is per unit time and directly proportional to the blood pressure. More the venous return, more will be the pressure definitely. Similar is the length of a blood vessel directly proportional to the length of blood vessels. Again, BP will increase as per the length of blood vessel. And two chemical, I told you, vasoconstrictor and vasodilator. Constrictor, vaso means blood vessel, the one which will constrict the blood vessel. If the blood vessel is constricted, the pressure will increase. Blood vessel dilated, blood vessel will, the blood pressure will decrease. Okay. And the last factor that I'm giving here is the sex. Females have slightly lower BP than the males. Females have lower BP than the males. This is up to the age of 45, 44, 45. The phase is called a menopause when reproductive cycle will stop. reproductive cycle, when it is, the hormone will take care of BP also. But as soon as the reproductive cycle stops, it's called a menopause. Risk of high BP is there in case of female after this particular age. Okay, these are all the factors. We'll have a short note of 2 marks type here. Next, measurement of BP, and already told you BP is measured with the help of sphygmomanometer. Instrument consists of number one, inflatable rubber bag here, the one which is with the cotton covering, and the one which is connected with the tubes to the two part. Number one here, tube will connect to the bulb here, a bulb, inflatable bulb. This will inflate this particular cup. And another tube that will connect this one to the mercury manometer. Here we have mercury manometer. Mercury cylinder will be here. And when we increase the push the air from here, that will increase the mercury column here, and we take the reading accordingly. How to take reading, that we'll discuss. This is the instrument what we call sphygmomanometer. We also call BP apparatus, and the stethoscope will be required to listen the sound produced during the measurement of BP. How is the measurement carried? A person is asked to lie down in a sleeping position. We take the BP generally. The instrument is kept very close to the heart. The cup is tightly wrapped around the upper arm. So we take the blood pressure here. The cuff will be wrapped around here tightly, and cuff is inflated till the brachial artery is blocked. So we inflate with the help of that bulb, so that the flow of blood will stop completely, because we are going to listen the sound here. And remember, once the blocking of artery will take place, we start taking the readings. Now pressure we release from the inflatable cup slowly, so that we hear the first pulsatile sound, and this will be the first pressure indicated in the manometer at the first pulsatile sound that we hear. This is for systolic BP. Means once we start releasing the air, slowly steadily the inflatable cup will release, and the blood flow will start. First sound when we hear, we take the reading in the mercury manometer, that will be systolic BP. Sound heard during the measurements of a correct sound. Remember, the pressure in the cup is further lower till the sound stop or sound start muffling, or sound which we hear becomes smooth, or it stop coming. And that time we take the another reading. Pressure indicated in manometer is called diastolic BP. So we take the two sound. Number one, when the sound start coming and when the sound stop coming, and this particular measurement gives systolic and diastolic BP. In a normal healthy person, I told you, normal BP will be 120 80 mm. You must have seen working of this instrument when you carried your parents or grandparents to the hospital. That's it. We'll stop here. Test again I'm giving you regarding this topic. Blood pressure points I'll be giving in the next lecture. Okay, here we are up to. We started today with the blood vessels to discuss with, and then we discuss regarding the we discuss about blood vessels. Three are there: artery, vein, and capillary. And then we concluded about blood pressure here. We said the pressure created by flowing blood in a wall of artery. This is called a blood pressure, arterial blood pressure. And we'll have two systolic and diastolic BP. When we said we have two types, the high BP and the low BP, we discuss the factor affecting the BP and the instrument working of the instrument. Instrument need to be seen, and instrument need to be handled. Whenever time permit, we'll have that practical. Okay, here we are up to. We completed up to the blood pressure here. Now we have a disorders related with circulatory system that will conclude in the next lecture. Okay, we'll stop. Thank you.